So we're here to talk about how to fill out an orthotic prescription form today. So the orthotics are done. I took them off of our patient Cindy, who we used in the as a guinea pig. You can see how I put her initials inside of the orthotic. We like to do that in a couple different places, just to make sure that she, when they get them at the factory, that they're clear on who they belong to. Okay. You're also going to include a physical copy of her custom orthotic prescription form. And so what I'm going to do is I'm going to show you how to fill this out online so that it's clear and easy to send with the orthotics back to OrthoRite. So I'm going to go ahead and share the screen here. And I will show you how to fill out the orthotic form. So this I just got from orthorite.com. So we're just going to go ahead and fill in. I'll just go through the whole thing so we're all clear. The date is 11/7/23. I put the office phone number, the address, I can get all this information from her chart. I don't ask, I always just guess what the weight is. It's not that important. Shoe size, type worn, occupation, none of those are important. The diagnosis and observations aren't really important either. The key here is that we want to make sure we always do the cast in non-weight bearing. Okay, so that's important to know. And then it's the types of orthotics. So there's two main types of orthotics that we sell here at Concierge. There's a semi-rigid or a sports orthotic. And the two most popular there are, I would say, the SportRite and the GraphRite. The GraphRite I like for like teenage athletes who need to be able to slip them into their shoes. And the SportRites are good for just, anybody who's got a flexible forefoot varus, and we really want to control that motion. So somebody with plantar fasciitis or acute Achilles tendinopathy, and typically people who are younger than like 55 to 60 years old. So anybody over the age of 60, I'll typically move from the sports to the accommodative orthotic, like a FlexRite. I almost always choose FlexRite. It's the top of the line accommodative orthotic that OrthoRite makes. And the biggest difference between the sports and the accommodative is just the material of the arch. So in the sports orthotic, it's made of a hard plastic. It's a semi-rigid orthotic, and that's really meant to control motion. The accommodative orthotics are made out of cork, and that's made to allow a little bit of motion and sort of for an orthotic foot, and it's just not as difficult of a wear-in process. So we use the FlexRites for generally people that are 60 years old or older with a flexible forefoot or just a flat foot. In terms of extensions, I always do full foot. We post to the cast. So we don't do any sulcus or overshell. I never do any of that. And the rear, I don't do rear foot or forefoot posting. I just say post to the cast, especially the first time. If there are issues or if you have questions, somebody doesn't, like their orthotics or they feel like it's too much or too little, it's typically because the cast, they moved when we were getting the cast done. So just click post to cast, and if they have issues or if it's rubbing somewhere, you can always send it back to OrthoRite. But in all my years doing it, in 10 years, 11 years, I've only sent one or two pairs back. So they do a really good job. In terms of the cover, we use Spenco. It's just a blue kind of foam cover. There's no partial foot prosthesis for her, so we're good there. I like to do a deep heel cup because that controls the calcaneal motion. So I do that on both sides. And there's plenty of options here, guys. You could do Met pads, you could do an aroma pad, first rate cutout if they really get decreased range of motion at that first Met and you want that first Met to be able to get just a little bit more extension. I try to keep it simple. And if you have questions, just shoot me an email and I'm happy to discuss it either in person in the clinic or via the phone. So these can get a little complicated, but just keep it simple at first. And I'm happy to go through the first couple sheets of prescription forms with you just so you get comfortable with it. So and then down here we just do the doctor's signature. and then we're good to go. I don't do the umbrella policy. I just take care of people for that. So if they have an issue and they need a new orthotic, we take care of it for them. So that's how you fill out the orthotic prescription form, and that's sort of my thought process. Again, for the sports versus accommodative orthotics, it really depends on age, and then how that foot is moving. If there's a lot of movement and they're young, you want to make sure that you post with a solid semi-rigid orthotic. If there's not a lot of movement in the foot, but they've got medial knee pain and hip pain on the outside and some foot pain, um, and they're overpronating and they're older, I like the accommodative orthotic. So for Cindy, we're going to do accommodative, and this is exactly the way that I would fill it out before I send it to uh, OrthoRite. So thanks so much.